Thank you for joining us tonight. My name is Barry Erickson, and I am Community Engagement Coordinator at Wheaton Public Library. Tonight, we are proud to bring you the first session of our new series of ACES, Aging and Caregiving Engagement and Support. Tonight, staff from both Metropolitan Family Services and DuPage County Community Services will provide an overview of what they offer. Both agencies have a multitude of programs to support and assist you. Marina Vargas is an information and referral specialist working at DuPage County Community Services for the past 13 years and has over 30 years of experience in the nonprofit sector. She is not only an AIRS certified community resource specialist, but also a certified senior health insurance program and Affordable Care Act counselor. Kelly Reed is a licensed clinical social worker who has provided counseling to older adults and support to family caregivers for over 25 years at Metropolitan Family Services, a local non-for-profit agency serving residents of all ages since the 1930s. MFS also provides services in the areas of early childhood education, family shelter, and mental health. So with so much expertise and wonderful information to provide for us tonight, I'm going to turn the screen over to Kelly and Marina. And I believe, Marina, you're up first.
Thank you, Barry. Hello, everyone. I'm so happy to be here and talk to you and share all the information that we have about our programs for our community in DuPage County in the lab for senior services. Let's start here. Okay. So here is the intake and referral screen. We at DuPage County Intake and Referral Unit work providing services, information to anyone in general. We love when people call us and ask questions to us. We do a comprehensive assessment and link clients and people to the appropriate services. We can support clients that all sort of programs like the medical assistance program, the marketplace, the Medicare, the Medicaid, access to DuPage, some financial assistance. We do have all sort of programs and information for everyone. The best tip or the best gift you can give someone that has questions about the community is our number at DuPage County Intake and Referral. We do have, and you can see here, a list of programs about the ACA. We do help clients to apply with the ACA. My unit in community services work very close with DuPage County Health Department to help all clients in the community. We do have the basic needs. You can see here that one. We have an in-kind goods basic needs program. Our clients may receive a voucher for clothing, household items, furniture, vouchers for eyeglasses, and some assistance for prescriptions for eligible clients. Then you see the benefit access. We do help with the benefit access. I call it the most like it program. They love this program. It helps seniors with the ride-free transit and the Secretary of State license plate discount. And it's a good discount. So we have clients that, I have clients that they were over 80, they're still driving, and they're just applying for first time. So they have been losing a lot of money because they didn't know the program. So if you know someone that is a senior and is still driving, just give them a number, or someone that is in disability, and also they have the ride-free transit card, which is very nice. Now we have here the home repairs and homeless prevention. We do have a homeless prevention program for residents of DuPage County. The housing management works with different grants to help eligible clients. Always refer our clients if someone is looking for a housing or is homeless and is looking for security deposit. We have many different grants, and we can try to help them or give them resources and options. I just want to say that at this moment, and it's not here, besides our security deposit for homeless and rental assistance, we have financial assistance for clients that are in the hotel. And this is very much because of the COVID. So we have assistance for clients that have been living in a hotel and they're about to run out of their funding to keep paying for the room. So if you know someone, please. Then you see here like low income home energy assistance. We get very busy at this time of the year. We just opened our phones for scheduling appointments. Officially, LIHEAP begins in September 1st this year, and it's for everyone, regardless of if they are seniors or receiving disability or disconnected. Everyone can start making an appointment, and we will do a screen for eligibility with their income. LIHEAP assists low-income household with direct financial assistance credited to the ComEd bill or the NICOR bill or the City of Naperville bill. Weatherization is a very nice program, provides energy conservation measures to income-eligible households to aid lowering the cost of heating and cooling. And they can help with sealing cracks, insulating windows, check for furnace. If the furnace is broke, the program may be able to pay for the replacement. Now we have Medicaid and SNAP. We do help clients and we support them applying for Medicaid and SNAP. As a general, and I want to make a reference of that, as a government, we make referrals to other government agencies or institutions and for nonprofit organizations. We don't sponsor a specific person. And I said that here because the legal assistance, we have quite a few calls about like, what is the best lawyer for this or that? Yeah, we don't do that, but that's why we provide all this information about our not-for-profit agencies in the area. I'm going to talk more about some programs in the later slides. Here is transportation. So if benefit access was the most liked, transportation is the most wanted. And I think it's going to be soon in one of those TV shows as most wanted. The Ride DuPage provide subsidized taxi and lift-equipped bus transportation for all eligible clients in DuPage County residents. A Ride DuPage is for low-income clients under 200% of the federal poverty level with no Medicaid, because Medicaid provides they have the information to pay for the taxes for the people who is receiving Medicaid. And ours is only for medical appointments, but we do also have the beautiful senior free ride. We don't have it all year round because we depends on our funding, but when we get it, we really get it, and people really like that program because it's one free ride round trip once a week, any place in DuPage County. All they have to do is register with us, and then every time they need to make a reservation, give us a call back. They call like 3 or 4 days before, make a reservation, and it goes from there. So it's a very, very nice program. It gives the opportunity to seniors to run errands and, and go to places, social places when they usually don't drive any longer. As part of that, we got a new one because of the COVID, the vaccine ride program. And that's very nice because we do offer that program for low income, or always give us a call if somebody doesn't have the transportation to go for the vaccine. It's a good idea to just give us a call. We have assisted residents of DuPage County since the beginning of the COVID. Each of our clients has been reached out during this time, and I help them with phone call. The case manager's license in the seniors department, they have contact all the clients from DuPage County Senior Services to assist them with the registration for the vaccine with the DuPage County Health Department, with the transportation. So it has been very, very helpful during these specific times of COVID. Here, Medicare. Oh, I love Medicare. I'm 57. I didn't know about Medicare. I'm so glad that I'm having the opportunity to learn about Medicare for when I turn 65. Yes, so Medicare is a free statewide health insurance counseling service. It's free for Medicare beneficiaries. It provides clients with general information and guidance about Medicare coverage and laws. We do get very busy when there is the open enrollment for comparison of the Part D, which is the prescription plan. So we really help our clients, trying to support them, and they make their own decisions. We never tell them what insurance is better than other one, but we can talk about the rights that they have with Medicare. Extra Help. I love Extra Help. This is a federal program for people who is receiving Medicare. So anyone that has Medicare can get the prescription plan. And if the client has limited resources and is low income, also may be able to get extra help from the Social Security to help with the cost of monthly premiums, annual deductibles, and prescription copayments. This program goes hand to hand with the Medicare Savings Program, because Medicare is from the state of Illinois. So let's say that not everybody, but a great majority of people who is eligible for extra help, it may be eligible for the Medicare Savings Program that pays for the monthly fee of the Part B that is deducted from the Medicare. The Social Security makes those deductions. So those are great programs to apply for. Options counseling. For a long-term care, options counseling is service focused on consumer education, and is often provided with an individual with his planning, like, oh, I'm planning that probably I need to go to a long-term care, or my mom needs to go to long-term care, or my aunt, my dad, anyone. So sometimes people, it's very confusing times and very stressful times. So it's a good, when clients and the families, the relatives, they have questions about what options they have. So, our team can help them and support them, but they're always making their own decisions and identify their own goals. So it's very self-driving program. Client driving, there you go, here it says that. Community care program, very popular program between seniors. Why? Because this program helps seniors to remain in their own homes by providing in-home and community-based services, include adult day services, in-home services, and emergency home response service. The in-home service is the one that helps the household with tasks such as cleaning, planning and preparing meals, doing the laundry, shopping, running errands. So the homemakers also assist clients with personal care, like if the person needs some assistance getting dressed or bathing or grooming. The adult day service is designed specifically for other adults that they cannot stay at home by themselves during the day. So they can go to these adult day centers. The program gives an isolated seniors the opportunity of socializing. I really like that program. They do in those daycare centers, they do medication supervision, recreational and therapeutic activities, and nutritional lunches. And the emergency home response service is a 24-hour emergency communication link to assist seniors with safety needs and mobility, and seniors that have some mobility limitations. The service is provided by a device worked by the clients. Money management. That's a great program linked to the community care program that we talked before and the adult protective services. It assists seniors that have difficulty managing their personal household budget, paying bills, keeping track of their banking records, and some other issues related to personal finances. It's a great program for so many seniors that they really get some confusing times. Home delivery meals. I love home delivery meals. They are delivered by the Senior Citizens Council. Is a great organization with many, many programs. They deliver fresh home, usually 5 times in the week, Monday through Friday. Like I said, the meals are delivered by the Senior Citizens Council. They are prepared by them. It's a donation-based program, so the clients have the opportunity to make a voluntary contribution towards the cost of the program. We said here the nationwide 1 in 6 seniors struggle with hunger. There are reports that the home delivery meals, over 80% of seniors improve their health and they feel safer and secure. Because now they have some food every day. They don't have to think or worry about it there. So it's a great program. Let's see here. Caregiver resources. The caregiver resources, we have some, is for, like I say here, the caregivers is a great program that provides resources for all our seniors, the caregivers, the grandparents. It has the service gaps. So like the grandparents, Raising Grandchildren is a great program that provides resources for grandparents or relatives under the age of 55. The program includes respite services, gap filling services that cover some of those expenses that grandparents have. Some very new is the T-Care, is the Caregiver Support Program. It's for the caregivers. And who is a caregiver? The caregiver is anyone who provides assistance to someone else who needs it. And AARP has shared some statistics, and they say that 54% of baby boomers generation is currently caring for a children, for a parent, or for both. So this program provides information about services, resources, individual counseling, support groups, and so gap filling with expenses. Now that we have been talking about COVID. During this time of COVID, with these caregiver resources, they came out with the help of other organizations to provide residents, senior housing residents with tablets, with iPads, with Wi-Fi, with headphones, protective case, and 1 year of data. I think we're not taking no more cases right now because we run out of that. Everybody find out and say, hey, I can have an iPad, and it's a nice way to keep in touch with our families and don't be so isolated. So that's one of the nice things that part of these caregiver resources and senior services resources help with. Let's say here, choices for care. That is it's a universal screening that anyone that is applying for a nursing home or for a supported living facility must have a pre-admission screening before they can be admitted to the facility. And these screenings are done by our case managers who do a comprehensive assessment, and they can discuss the appropriateness of placement and the Medicaid eligibility. So if you have a relative or somebody is moving to a long-term care facility, they're going to give us a call necessarily so we can set up the screening. Adult protective services. Our case managers investigate reports of mistreatment and provide intervention services to seniors or to persons with disability from 18 to 59. Adult protective services work with abuse, neglect, and financial exploitation. It takes many forms. This kind of abuse can take many forms, and in most cases, victims are subjected to more than one type of mistreatment. The Illinois Department on Aging shared the statistic that 4 years ago, in 2017, 52% of adult abuse reports alleged were financial exploitation, and 40% alleged active or passive neglect and emotional abuse. It's very sad. The abuser can be anyone. Sometimes it's even the same relatives, and the abuse can be intentional or unintentional. Anyone can report a case of abuse in good faith. Identity of the reporter is not disclosed, and we take also anonymous reports. All reports are recorded to the Adult Protective Services is strictly confidential. Part of this is the self-neglect, which has so many different expressions. The care coordinators investigate reports of suspect self-neglect and provide intervention. And self-neglect can be like, you are worried about a neighbor, you are worried about a family member that is not taking of their health or their home safety. Like for instance, if they, can be like a fire hazard, or their services are disconnected and they're not proactive, reaching out for help. So if you have concerns about person, just give us a call, and everything is anonymous. It's like they're not going to be releasing your name if you don't authorize that. I want to talk about the long-term care, but the long-term care ombudsman is an advocacy program which protects and improves the quality of life for residents in a variety of settings for long-term care facilities. Ombudsmen make every reasonable effort to assist, empower, represent, and intervene on behalf of the residents. The truth is, most residents receive a good care in long-term care facilities. However, far too many experience some sort of neglect. Ombudsmen advocate to improve the quality of care and quality of life for residents of these facilities, investigate complaints and concerns, and provide information to residents about their rights. I'm still not being able to move my screen, but I think that you can hear me. That was the end of my of my presentation, but I want to talk about something. For last, I can say that some of our programs always look for volunteers, like money management, ombudsman, the CHIP counselors, the home delivery meals. They're always looking for volunteers. So if you are considering to be a volunteer, always give us a call. Another one is our resource database. It's called DuPage Chris. I'm sure the library has plenty of information about that. It's a great website to look resources. We have over 1,000 resources, and every week they add more. So if you're looking for something and you don't want to give us a call or cannot give us a call, you always can search in our database. Another website that I really like it personally is the Impact DuPage. It's a great website to search for data that address county priorities and resources. And for last, the Giving DuPage is also a great website. It's a department that where clients can start looking for different volunteer opportunities with different agencies through DuPage County. I don't know if you, Barry, this is for you.
Okay, thank you so much for all that great information, Marina. Let's have just a couple of questions before we move on to Kelly's portion. Someone is asking about phone numbers, and I saw a lot of phone numbers and websites. You did give me a number of resources, and I will be sending those to everyone who's registered with the program. Do we need to keep track of all the different phone numbers, or could they just call the general number and be kind of distributed out where they need?
Excellent question. The best number, what we say first, intake and referral. Anytime that someone has a question, is looking for an answer, is looking for a resource, always give us a call, the 630-407-6500. That's the best number to keep on your refrigerator, because anytime that sometimes it's like, oh, where is this? Or is it, I knew somebody that needs that, or is anytime, just give us a call. That's what we do. We look for the resources for them.
Right, so they can just use that one central number and reach different services through that. Perfect.
Correct.
And someone else is asking about advice for Medicare. Do we understand correctly that if someone is going to be applying for Medicare, they can get advice for the right kind of plan and how to do that?
I am myself a CHIP counselor. And what we do here is we talk to you about the options. What is the first steps to do when you are going to apply for Medicare? And if you are already Medicare, maybe we can do some screening to see if you can save some money. I mentioned the open enrollment because every year who has Medicare and has a prescription plan is a good practice to compare. Hey, what is new? Because if you like your current plan, then you can keep it. But if you don't know, every year we can change prescriptions. Like now I'm not taking any, next year, who knows what I'm taking, and you want to compare the prices and who gives you the best. We won't tell you what is the best, but we can guide you in the direction of how to make a wise decision.
Great, thank you. And I will just mention, you talked about a lot of the protective services, and that screen is still, or that slide is still on the screen. We do have a particular program addressing those issues coming up again through this ACES series, and that's going to be taking place on September 15th. So we'll explore some of those services in even greater depth at that time if people have questions about that. So I think that's answered all of our questions for now. The Q&A is still open, and so we will have time for additional questions at the end. But let's, if you would, Marina, if you go ahead and stop screen sharing, and then Kelly can share her screen and do her part of the presentation.
All right. Well, I wanted to thank Marina. DuPage County is a wonderful community partner for us, and many of our referrals for come through the process of when one of the case managers goes out to meet a family to do an assessment, or talking to someone on the phone and may determine that they could benefit from some counseling services. And Metropolitan Family Services offers counseling services to all ages, but has some very special programs that are specifically for those 60 and older, or are geared toward people who are caregivers for other family members. So that's what I'm going to be talking about today. And the individual counseling programs that we have in non-COVID times were either office-based, or they were home visits. A lot of the service might be provided in the home, especially for seniors who might have difficulty getting to a counseling appointment. And also we've done counseling in facilities, in assisted living, supportive living, and even in long-term care facilities. And counseling can mean a lot of different things. So for some of our clients, it may mean that it's a client who's experienced depression, anxiety. They may have a chronic mental health issue that they've dealt with for a long time. They may have bipolar disorder or obsessive compulsive disorder, depression, anxiety, and they may be taking medication for those issues. But counseling can also mean someone who hasn't experienced a need for supportive counseling, but is looking for help in decision-making or problem solving, or maybe there's an interpersonal conflict in their family, and working on communication skills might be helpful. So a number of my clients, one of the things that they seek counseling for is just the stress that may come with dealing with multiple medical problems, and just the trauma that can be experienced from, having unexpected medical issues that impact one's life, or is a threat to one's independence. So it could be really looking at any kind of issue of aging, and trying to help a client set some goals and move towards some improvement or resolution. Sometimes the counseling may consist of some life review, and may even be appropriate for people who have some mild memory loss, and looking at aspects of their life and reviewing that might be helpful to them. So the individual counseling is done by, there's 4 of us who do the counseling services. We're licensed clinical social workers or licensed clinical professional counselors. And if someone was determined to benefit from seeing our agency psychiatrist, we can make a referral for that. And our psychiatrist is available using the client's insurance. If it's one of the insurances that the psychiatrist can take, we may make that referral, and they may need some medication management for that. We have a number of support groups, but a group that's been going on for the last several years is called a Life Transition Support Group. And it's for women, it's women 60 and older. And the purpose of the group really was less as a therapeutic group and more to address issues of isolation and loneliness and coping with changes that may happen after a divorce or retirement. Maybe a senior who's moved to the area and is having difficulty meeting people. So there's 2 of those groups that are meeting. And one of them is on Tuesdays from 1 to 2:30, and the other one is on Wednesdays from 10 to 11:30. They're being mostly by Zoom right now. One of the meetings, actually, we've done a combination, a hybrid, where some people are meeting in a park outside and some people are attending by Zoom. So we're just kind of monitoring COVID-19 to figure out when we can bring the groups back together in person, but Zoom is a nice option right now. Okay, and you can see that there's some phone numbers on there for the main intake number and our general number as well. And then there's some individual phone numbers if people want to speak directly with the social worker who's facilitating the life transition group. If you can move it to the next slide, Barry, then, or can I do it? Okay, so for our family caregivers, we also offer individual counseling if there's anyone who is caring for a family member who is 60 and older, or caring for someone who has early onset dementia, or has someone who has a disability. So the caregiver counseling can be very individualized to what the needs are of that family caregiver. So I have clients who have a weekly session, and every week there's issues to discuss with their caregiving that they're working on. They might be working on communication issues. They may be encountering some safety issues or behavioral issues with their loved one. They may be looking at trying to make some decisions about the level of care needed or how best to support that person in the home. So there are people at regular weekly or every other week counseling. And then there are other family caregivers that really are looking for maybe just a couple sessions or an occasional consultation about aspects of caregiving, or looking for resources or some kind of brainstorming to help them best serve their loved one. As with the DuPage County Senior Services, we also can do that T-Care assessment, and that's a 45-minute to an hour-long assessment that looks at many aspects of caregiving and identifies the areas of high stress. And the second step after that T-Care assessment is coming up with a care plan and some suggestions that are individualized to that family. We offer family caregiver support groups, and we offer one that's an evening one, so it accommodates the needs of working caregivers. And right now, again, they're primarily by Zoom. The evening one has had some in-person and Zoom at the same time, the hybrid model. And that meets twice a month. It's the first and third Monday at 6:30. And then there's a daytime group that's available as well. And that is the second and fourth Thursday of each month at 10 a.m. And once someone has a link for those groups, they're drop-in and they can attend as best fits their needs and their schedule. And it can be really helpful to feel like you're not alone in your caregiving journey and to be able to talk to other caregivers and get ideas and just feel supported in all the variety of emotions that come about as you're caring for someone that you love. And we also have some evidence-based programs and that run periodically. And one of them is called Stress Busting for Caregivers. And that's a 9-week class where each week you learn a different aspect of stress reduction and put it into practice in your caregiving. And we are doing that 2 or 3 times a year. And as I said, it goes for 9 weeks. And if I can, Barry, if I can have you go to the next slide. Up, back one. Okay. So the Grandparents Raising Grandchildren program is very close to my heart. I've been involved as a facilitator and co-facilitator of that program for a long time. And our agency has had a continuous running support group for, I believe, over 20 years for grandparents raising grandchildren. And it's mostly grandparents, but it really doesn't have to be a grandparent. It's really a kinship care program. So it may be, you know, an aunt who's raising their niece or nephew, or even someone who's identified as a family member, but really is not a biological family member, but is in charge and having custody or guardianship of raising children. This group has been meeting also virtually during the pandemic, and we have a daytime session, 1 daytime session per month and 1 evening session per month. When we're safe to be back together as a group, generally there's 2 components to it, which is where the grandparents are meeting together and then the children are together doing social, emotional activities that help them also address their stress and learn new skills for coping with you know, the many stressors that they've experienced. A lot of the children have experienced a lot of trauma in their life. And so the issues of the grandparents can be challenging as they try to find the resources to help their grandchildren and learn, you know, how to best help them cope with the traumas that they've experienced. We also help connect the grandparents to some of the things that were discussed earlier from the county, where there could be funding that might be for what we would call gap filling or respite. So if a grandchild was going to attend a special camp or, you know, needed new tennis shoes and there's not money for those shoes or a coat, there can be some funding available for those kind of things. There's a lot of legal issues that can come up with grandparents raising grandchildren. And we try to also work with other community partners such as Prairie State Legal Services. And I think that covers the majority of our programs, and I would welcome any questions about it.
Okay, I'll go ahead and stop the screen share there. And just a reminder to everyone, if you would go ahead and open up your Q&A so that we can enter any questions there. Kelly, there is a question here for you. What is the cost of joining a support group?
So all of the programs, the individual counseling programs, the caregiver counseling, the support groups are all offered at no charge with the help of our funders, which include Age Guide. And Age Guide helps distribute funding, federal funding from the Older Americans Act. We also receive United Way funding. The one exception with the fees would be if someone is seeing our psychiatrist, they may be, their insurance kicks in and they may have a co-pay or deductible, that kind of thing. And then occasionally there may be a small cost if one of the programs has a material like a book that you need to buy for the class. But primarily everything is at no charge.
Great, thank you. Lots of wonderful resources there. I know that recently we had someone come into the library just needing some help in kind of an emergency situation, needing to help their loved one get into some kind of facility where they would get some greater care. So just a question to both you, Kelly and Marina, what sort of services might be available in that kind of situation?
Well, I think, go ahead.
Go ahead.
So sometimes, it may be a matter of just trying to do a phone, talk to someone on the phone about the various options. If it's a situation where there's a possible self-neglect, where there's, someone is at risk and in danger of, having a health issue by being in the current care level they are, then we would make sure that we're referring to the Adult Protective Services as well. Talking, about how to come up with a safety plan.
Yes, Kelly, you are so right. If someone goes, again, I don't get tired of saying call a number, because we do a screening and we have a whole department just for take the cases of self-neglect or abuse if we're talking about that. But also like the options counseling, the program I talk about, like a person is desperate. They don't know what to do. They don't know what to go. They don't know if there is resources to stay home when you're a senior and you have some limited capacities to do your everyday chores. So that's when we can talk and we can start talking about, what they're looking for. What are they looking for? So that's how we see in our department, in the Take Care Referral unit, we start doing the screening. It's true, we ask a lot of questions in a nice way so we can get an idea of what is needed, and then we start offering services, because sometimes I can stay over an hour on the phone because the person goes to community care and then it goes to utility bills and weatherization and clothing and vouchers and and the person, benefit access, remember the most likely program. So it's a lot of resources there what I said is true. I have talked to clients that they have been there for a long time and they have been paying a lot of money for a sticker when they were low income. And that brings a lot of pressure in the families, the financial, it is bad. And then we also have the food pantries and anything. Always give us a call.
Right. There are so many wonderful services out there, which is one of the reasons why we wanted to provide this, just to raise the awareness of all of the great things that are available in our area. Someone is asking, Kelly, where exactly is Metropolitan Family Services located, especially as some of these care support groups and counseling services are starting to go back in person?
So we have our main office is in Wheaton. It's on Willow Avenue. But we also have social workers who are housed in Elmhurst City Hall. And we have an office in Woodridge. So those are the physical locations. And then we serve anyone who's a DuPage County resident.
Okay.
So the home visits, again, with COVID kind of pending, but you know, that could be anywhere in DuPage as well.
Okay, great, thank you. And someone else is asking about the fall program for caregivers. This might be about the Stress Busters program that runs in the fall. Their question is just where and how will those be conducted, those classes?
So right now we're on session 4 of a Stress Busters class. So it's probably too late to join because it's a 9-session class, but we will be, I'm sure, coming up with our next date not too long from now and trying to advertise that. So we can get someone on a waiting list as well to know that they're interested in it. And also we might be able to help connect them if another community partner is going to do Stress Busters before we are offering it again.
Great. So again, both of you have given me a number of different resource links to send out to the registrants of the program following tonight's presentation. And so if, Kelly, if they were to call you, they could get on a list to be notified or to be allowed access to possibly some information about other programs in the area.
Yes, we would also see if there's another class that's starting sooner.
Right, sounds good, sounds good. Okay, I don't see any other questions in the queue, but we want to go ahead and allow people one more minute if they happen to think of something. Something that came to my mind, again, sometimes we have questions at the reference desk at the library. I'm just wondering, sometimes loved ones are farther away and they just want someone to check on their loved one that's living in the Wheaton or DuPage area. Are there any services for that? I'm thinking perhaps if they got some meal service or something like that, just so that someone is checking on them from time to time. Is there something like that?
The Senior Citizens Council volunteers, they check on the clients because they're delivering the meals. So that works one way, that way. And I don't have the number right here, but of course, call 407-6500 and I will give you the number, any of us, that the residents can register. And that's with the sheriff's department. So they will do, you know, they will check periodically in the seniors. And of course, if it's kind of like an emergency, always the police department. As a quick reference, when somebody's worried, it's always referred to the police department because they're the only ones who can really go out of the blank.
Right, great advice, great advice. Kelly, did you have anything to add there?
I was going to say that also DuPage Senior Citizens Council, in addition to doing the meal delivery, has been doing a phone call matching program. So they're matching a volunteer to a senior in the community. And that might be another way to have kind of a check-in.
Right, especially as the winter approaches and we're able to get out less, that might be a great way to go. Thank you. I do have a comment or question here for you, Marina. They're wondering if they call this wonderful general DuPage County number, can they ask to speak directly to you?
We have a team, but anybody can ask for me. And I may be busy on the phone. I'm quite busy. We are all quite busy, but I always return my phone calls. And if somebody just have some questions about like today or have more questions or want to make comments, please ask for me. Definitely, I'm open. That's what I do. And I love to answer calls.
I see. And I think maybe part of the concern was that the person was concerned about reaching someone who could speak Spanish with them so that they could really be able to communicate all of their needs clearly.
Yes, definitely. We have the option. We got a new phone system recently, and the option of Spanish is there, but any other language, because if somebody say, hey, no, don't speak English or Chinese, just say the language that they speak, and we will call with the interpreter line. So we do that. So and even for the services, if the person is going to be asking or applying for some services, and they need to have Spanish is so kind of easy because we have several people that speak Spanish, we're bilingual, but any other languages, we are there to help and support.
Wow, that's great. And I'm constantly impressed by all of the services that are available through both DuPage County and through Metropolitan Family Services. I'm constantly learning about new things that you all do, which is, again, one of the reasons why we wanted to provide this. So I don't see any additional questions. So we certainly want to thank you, Marina and Kelly, for providing this information. I know it takes quite a bit of time to put all this together for us, but thank you so much. We are going to be sending out additional resources, again, those all important phone numbers and websites, so that people can access that information and ask more questions and get access to these wonderful services. If you are watching the recording of this program and would like those links, please email me at ce@wheatonlibrary.org. That's CE for community engagement @wheatonlibrary.org, and I would be happy to send those out to you. So with that, again, I don't see any additional questions, so we will say good night. Thank you to everyone for attending. Take care, and we hope to see you again soon. Good night.